Hey friends, welcome to my channel Photographic Memory. So today's topic will be parotid gland. So I'll be talking about parotid gland, its nervous supply, blood supply, its boundaries and everything. So let's start with it now. Firstly, parotid gland, as you can clinically see, is situated below the external auditory meatus. As you can see in this diagram, parotid gland is the green marking one and it is situated below the external auditory meatus. I'll just give you a brief description about parotid gland. So this gland is present on the lateral surface of your cheek. It is the largest serous salivary gland and it consists of facial nerve, which is also called as the queen of the face. This can come as an SAQ to you, that which one is the queen of the face. So facial nerve is the queen of the face and it is situated in the parotid region. This parotid gland weighs about 25 grams. As I told you earlier, it extends from the external acoustic meatus or external auditory meatus to the angle of the mandible, as you can see over here, and it may progress downwards. It is present between the ramus of the mandible and your sternocleidomastoid, anterior and posteriorly if you go to see. So anteriorly, it also overlaps the masseter muscle and posteriorly the sternocleidomastoid muscle. So if a question comes regarding parotid gland, you need to specifically draw this diagram first, jotting its boundaries and the extremities of this gland. I'll be talking about the extremities as well. So this parotid gland is supplied by Tenson's duct or the parotid duct. Its extremities are jotted over here. As you can see, these points, 4 points, these are the extremities of the gland. So the first point is the A point. It is at the upper border of the head of the mandible, that is the condyle. The second point is just above the center of the masseter muscle, as you can see over here. The third point is over here. It is posterior inferiorly to the angle of the mandible. And the fourth point, as you can see over here, is upper part of the anterior border of the mastoid process. So these points can convey you the anterior and the posterior border. So the anterior border, as you can see, is made by the 3 points, which is A, B, C, and the posterior border is by joining the 2 points, that is C, C and D. So this is the basic outline of the parotid gland. Now this parotid gland is covered in a parotid capsule, which is made up of the investing layer of the deep cervical fascia. So this cervical fascia splits into two between the angle of the mandible and the mastoid process to enclose the entire gland. So there is a superficial lamina and a deep lamina. Okay, there are two parts, superficial lamina and deep lamina in it. So the superficial layer, as you can see over here, is made up of the investing layer, and this layer is thin, whereas the deep layer is a thicker layer. A part of this deeper layer, that is the deeper lamina, makes the stylomandibular ligament, which separates this parotid gland from the submandibular salivary gland. You can't appreciate the stylomandibular ligament in this diagram, but you need to note down that point. It can come as an SAQ as well. So let's go to the boundaries. As you have learned about the surface markings, it will be easy for you to learn the boundaries as well. Now, while learning the boundaries of the parotid gland, just remember this, that this parotid gland is an inverted triangle. So the base is at the condyle and the apex is at the angle of the mandible. So you can appreciate it as an inverted triangle or inverted pyramid. If we cut a section of this gland, we can appreciate the boundaries from internally as well. So this is the anterior medial surface. This is the posterior medial surface. This is the medial or pharyngeal border, this entire. This is the superficial surface. This is the anterior point and this is the posterior point. So the superior surface, as I told you, is the base of this pyramid and it is related to the external acoustic meatus, the temporal vessels, the auricular temporal nerve and the condyle. The anterior medial surface is grooved by the posterior border of the ramus, the masseter, medial pterygoid, and the emerging branches of the facial nerve. The anterior medial surface is molded by the mastoid process, the styloid process, and also other structures such as the sternocleidomastoid muscle, the posterior belly of the digastric. It cannot be appreciated in this diagram. As you can appreciate in this diagram, this is the parotid duct. It is a thick-walled duct and it is about 5 centimeters long. It emerges from the anterior border of the gland. It turns medially, it pierces the buccal pad of fat, the buccopharyngeal fascia, buccinator muscle obliquely. This duct has an oblique course. It runs forward, downward, like a little slightly downwards on the masseter muscle. Now, this duct is superiorly related to the accessory parotid gland, the branches of the facial nerve, and the transverse facial vessels also. And inferiorly, it is related to the lower buccal branch of the facial nerve. So this is about the parotid duct. Then we'll come about, you can appreciate the anterior medial and the posterior medial borders in this diagram. Anterior medially, it is the ramus of the mandible, the masseter muscle, the medial pterygoid, whereas in the posterior medial surface, it is molded by the sternocleidomastoid muscle, the styloid process, the posterior belly of the digastric, and the mastoid process. So the contents, as you can see, are over here. Now, as you can see in this diagram, the external carotid artery enters the parotid through the posterior medial surface and it exits the parotid through the anterior medial surface. I'll be showing you this exactly in the next upcoming diagrams and you can appreciate it well in that. Just have a look of the contents over here first. So this is the external carotid artery, the retromandibular vein, which is actually formed in the parotid gland. This is the facial nerve. These are the lymph nodes. Okay. So let's go on to a further diagram. So this is the basic diagram of our vessels of a parotid gland. As you can appreciate in this diagram, this is the artery and this is the vein. I'll just briefly describe you this diagram. This is the parotid gland highlighted by the green marker. This is the external carotid artery which passes through the parotid gland, and this is the vein which passes through the parotid gland. So external carotid artery, as you can see, enters from the posterior medial surface and it exits via the anterior medial surface over here. From the gland are the maxillary artery, posterior auricular artery. Now the maxillary artery exits through the anterior medial surface and the posterior auricular artery may arise within the gland and it exits from the posterior medial surface. The superficial temporal vessels and this transverse facial artery exits from the anterior border. Okay, so this is about the artery supplying the parotid gland. Now we'll go to the vein which is supplying the parotid gland. So the retromandibular vein, as you can see over here, is actually generating from within the parotid gland by the union of the maxillary vein and the superficial temporal vein, which then further divides into the anterior and the posterior divisions, which emerge or exit via the apex of the gland. Okay, I repeat again, the retromandibular vein is actually formed within the parotid gland and it is formed by the union of the maxillary vein. Then after going through the vessels and vein, now we come to the nervous supply of this gland, which is supplied by the facial nerve. It enters through the upper part of its posterior medial surface, as you can appreciate over here, the upper part of the posterior medial surface, and it then divides into its terminal branches, first dividing into the temporofacial division and the cervicofacial division, and then further dividing into your temporal branch, zygomatic branch, the upper and the lower buccal branches, the marginal mandibular branch and the cervical branch. This is all about the anatomy of parotid gland. Now the superficial parodectomy is done through this facial-venous vein. I'll be talking about this in my further video, that is part 2 of parotid gland, where I'll be discussing about the surgical management of parotid gland. Thank you for watching Photographic Memory. Please stay tuned with our channel to know the surgical management of this parotid gland and more such videos. Don't forget to like, subscribe my channel Photographic Memory, and even share these videos with your colleagues if you find it helpful. Thank you and take care.